Welcome back to N-Powerment Nursing. I'm Ashley and I'm a nurse educator, and this week we are applying In the Know and we're going to be doing some respiratory questions. So I invite you to watch our Facebook Live videos that we post each week. You can also participate by commenting your answer in the comments below as you watch this video. So this week's question is a respiratory question, and we are actually going to do some ranking, which can be daunting for some students. So here's our question. Rank the order that the clinical manifestations will appear in a client experiencing an exacerbation of asthma. A, hypoxia. B, a pH of 7.52. C, anxiety. And D, a pulse drop to 48. So let's talk about clinical manifestations of asthma. What's happening in asthma is that the airways are becoming constricted, so tight. You often hear wheezing in patients that are having an asthmatic attack. It's one of the number one signs and symptoms. So what happens is basically the respiratory tree starts to constrict and the patient gets air hungry and there's a decreased oxygenation. So if you know critically kind of the pathophysiology of what's going on in asthma, it helps you critically apply that content knowledge to come to the right answer of this question. So the correct order would be A. First, the patient would experience hypoxia, which is a low oxygenation level in the blood. And that would happen first because as that airway is constricting, right, less oxygen is getting in from the atmosphere into our oxygen exchange in the base of our lungs. So hypoxia would be our very first clinical manifestation, followed by C, anxiety. If you've ever cared for a patient clinically who has a low circulating oxygen, you would know the fear kind of that comes over a patient's face when they are oxygen hungry. It's some of the most terrified patients I've ever personally cared for in my practice. The next would be B, a pH of 7.52. Normal pH is 7.35 to 7.45. So a pH of 7.52 is high, which would be basic. And that's happening because as the asthmatic person is hyperventilating, they're blowing their acid out, which is how we get acid or CO2 out of our body. Therefore, their body is becoming basic, followed by their pulse dropping to 48. Hyperventilating causes the pH to increase, and then bradycardia, right? A low breathing rate is a very late sign of hypoxia, and that would happen last. So again, to recap, our correct order would be A, hypoxia, C, anxiety, B, a pH of 7.52, and D, that pulse dropping to 48. So for the answer to this question and more, you can view our complete study package on our website, and we will join you next time on In the Know. Bye for now.